Thank you so much, Krystal. We're so glad to have you.
Thank you for the lovely introduction, Jessica. I appreciate it, as well as being a collaborative partnership with you over the few years at Goodwin Living and us at the Virtual Brain Health Center. So I will go ahead and do my best to give an introduction and background before we dive in today. But I wanted to point everyone to the chat because I would love if this could be a little bit interactive. So if you have thoughts, questions, comments as well, I'll do my best to respond them as we go and save time at the end for questions and answers. That would be great as well. But a little bit about me, I like to do not only just the bio, but some disclosures as well, as I think that's a great way to share perspective as well as the times that we're in of things that I'm involved with. So by training, if you were to get a snapshot of me in my office, you would see hopefully one of my 5 dogs will be quiet today. But if you hear anything, it's one of my 5 office mates. They like to be Zoom famous, so sometimes they get a little yippy. Hopefully not today while we're on Zoom. But by training, I trained in all of the social sciences related to brain health. So psychology of aging, sociology, gerontology, and my doctorate is in behavioral health. And I focused on healthcare management. So systems and policies and how do we design better programs and services in the healthcare systems to better serve population health and systems and save dollars around healthcare. And I had the good fortune of being the first scholar from the United States to train at the Global Brain Health Institute at Trinity College Dublin, Ireland, where I got to learn about brain health at a global perspective. So, a once in a lifetime opportunity to bring that lens to my work, and have spent that time running a brain-based community center around brain health on senior living campuses, have done that work in social model adult daycare programs, putting brain health into those levels of memory care, have helped health tech startups put in brain health programming and multiple types of health and wellness programs, and have done brain health now in schools and different initiatives. So that's where I wanted to put my disclosures. I've read a book by economist Alec Edmonds, and he changed my perspective and said all speakers should include disclosures, not just financial incentives about grants. So we'll let you know the types of projects that I am involved in. I'm doing strategic advisory work, as well as where I volunteer my time. In full disclosure, the only type of modest honorarium I receive is doing grant review work for the Michigan Health Endowment Fund. And that honorarium is then fuels my podcast. So that helps give in-kind work around brain health education and provides free CEUs for healthcare providers now, which you'll get that information towards the end in case you happen to need CEUs and are one of the healthcare providers that we're able to offer that towards. You can get that information too, but want to at least lay that disclosure of that's the lens I bring to this brain health conversation, is really interdisciplinary work around all the social sciences and brain health. And has spent about the last 15 years studying and working in the applied practitioner type spaces and really trying to make sense of my first question for all of you here today is, why does brain health matter? Why are we hearing so much about brain health in the spaces that a lot of us serve and do this work? Why does brain health matter to you? This can be personal. This may be broader implications as well. You can reflect on that. If you have thoughts, feel free to put this in the chat. But I am going to take this very big picture and then bring it a little smaller for us today. And then I'm going to pivot to defining, I think, next, what is brain health, and then get into more of the science behind all of those pieces. We have a quiet group. But I'm hoping that means you're thinking about, why does brain health potentially matter for you, your loved ones, perhaps the communities you serve through your work? It may be your volunteerism, your outreach, or the spaces that you encounter in your day-to-day lives. But let's go big picture first. Why does brain health matter? And I think you guys are using really core words that show up in a lot of the definitions around brain health. We see it, yes, coming up, the core identity of people, especially across the aging care continuum. Brain health is important. It's the essence. The brain holds the essence of who we are as human beings. A lot of that shows up in the philosophical meaning of the brain of who we are. It matters so we can thrive in our present day as well as who we want to be in the future. It's an important topic because we are living longer. And we're going to talk about those terms depending on the discipline you study in, what those additional years, what we call that, what that looks like for all of us. And it's not just being only the physical body that ages, but the brain aging. And we look at that. You guys use the key words. A lot of us like to use the words to thrive. And it's important for many of us, the people we serve, as well as the aging care workforce. And how do we create the best environments for those that we serve? How we go about communication and how we think differently. So I think we're all going to have a nice conversation in our time together about why brain health matters. What are the things that we can do to support ourselves and those we serve? Where does the current science stand? What are still some of these emerging issues that come online? And where are some of the places we can go to stay up to date? Because I can tell you, this science is changing fast. I just read 2 or 3 new studies that came out this week. There's more that will come out today and tomorrow. But how do we stay up to date and take that information and apply it to the work that we are doing? So let's go big picture first of why does the brain health matter on the global scale? We see that worldwide, 1 in 3 people are impacted by neurological conditions. And these get clumped together of 37 leading brain conditions. You can see more towards the bottom, there's a whole global status report. If anyone wants to do leisure reading around this, I'll just wanted to point you in this direction. But if you're thinking about leading brain conditions, you have your neurodegenerative diseases, Parkinson's, Alzheimer's disease, multiple sclerosis. You have other ones that leading to impact the brain, like stroke, migraine. You have developmental disorders that come on early in life that impact all across the lifespan. We see these rising since 1990. And I'll show you what does this look like if we were to pull up the United States, and what does this look like by age group. So they created this brain index. And if you want to look, it starts to look at ages 5 to 9. So going down here on the side, you can see your ages. And then across is the number of people being impacted. I like to say, look at the orange bars here, your neurological disorders. The blue is then your mental health disorders being clumped together. And you can just start to see how that number starts to grow going across each age group. So from young children all the way as people are starting to live longer, more individuals being impacted by age. So if you're starting to hear more commonly, why are we talking about brain health for all ages and stages of life? We're really starting to pull brain health from just later adulthood issues all the way down this lifespan now. We're seeing the numbers being impacted, not just neurological disorders, that orange bar, but mental disorders. That blue bar is growing, and it's growing larger, especially among younger age groups. So this is a lot of why we're having this preventative health conversations around brain health. And we want to start talking to people earlier on about what are they doing for their brain? How do we have these brain health and brain care conversations? And then let's just talk about your average American. So what are these brain health conditions that impact most adults? If we go to research from the Dana Foundation, 8 out of 10 Americans are impacted or directly or indirectly, meaning they themselves or someone close to them that they care for have a brain-related condition. So if you're looking at this slide, you probably have level of awareness of the leading mental health concerns: depression, anxiety, neurodegenerative diseases, Alzheimer's, dementia. You're seeing Parkinson's, you're seeing other brain-related conditions are the leading causes. So we have this level of awareness that it impacts most of us today. And I just wanted to point to a tool that we are all probably sitting here thinking, now we know why so many of us are passionate about talking about brain health or have an interest. It directly is impacting us, someone we love and care for in our daily lives, or someone directly in our networks and those that we care for on a day-to-day basis. And it is going to impact younger people. earlier, and we're having these conversations earlier with younger groups and people within our families and our communities. So now the next big question is that we're thinking about, what exactly is brain health? And if we have thoughts about this, I'd love to hear that in the chat. And if you're sitting here wondering, I'd like to know what brain health is too. This has been a definition that has been a moving target over time. It has been one that we still have been working to define. And it has been a conversation that has changed because a lot of the talks and conversations over the years have gone from brain health to memory to dementia, as if they're sequential stepping stones, and there's a lot that happens in between. And you can think about, if we're talking about younger adults, there's a whole lot that happens in between those stepping stones. And we have historically had brain health somewhere close up under the Alzheimer's and dementia space umbrella, and we've slowly pulled it out to say now brain health is this lifelong life course conversation. And so now we have been working on defining this definition. Most previous definitions solely focused on cognitive skills, and that's why memory is a big piece of this. A lot of the conversations around Alzheimer's and dementia, we say memory is like the key component. Well, it's one of the components, right? Yeah, I'm glad a lot of people are curious where it's say we use the term brain health, we hear about it a lot, and there's a lot of different qualifiers around brain health. And this is one where I like to say I don't have the exact perfect answer for you, but I'm going to give you a few options and hope this can help broaden the horizons and definitions. So I'll start with the most broad definition of brain health that we have. So brain health is involved with everything we think, feel, do, and say. And after you hear that, you're probably thinking, well, what probably isn't involved in brain health after hearing those big bucket areas, all of your thinking skills, cognitive health, your feeling is your emotional, your doing is a lot of physical or action oriented, and saying can be thinking, a lot of other broad skills as well. So let's get to some of the definitions that we've had before from the CDC as well as Administration of Community Living. Had ones that focused a lot on the mental processes, including cognition, where we look at learning and judgment, language, and our ability to remember. Probably ones most of us brought up to the forefront of our mind if I asked you about what came to mind under brain health. Other ones on that list, planning, concentration. That last one, the ability to maintain a clear and active mind, is one that broadened brain health out a little bit more of the demand of cognitive skills and bringing on some of the emotional states. And I like the one now that I'm going to give you from the World Health Organization, because they believe this is the most holistic one of brain health that looks at the broader lens and all of the domains of health and well-being. So good brain health is a state in which every individual can realize their own abilities and optimize their cognitive, emotional, psychological, and behavioral functioning to cope with life situations. It even goes on to include that this is irregardless of a diagnosis related to their brain. So it does not matter if you have a brain-based diagnosis or not. Everyone has a right to good brain health. And so that's been a large shift in the field as well. We like to simply say at the Virtual Brain Health Center, it's our brain's ability to grow strong and thrive at any age is also another way to look at brain health. And we'll get into some of the neuroscience terms behind this, but you can think about these definitions and how it's very holistic. It's not just heavy focus on the cognitive domain. It's one aspect of brain health. And when we start to get into what are some of the foundational pillars that we look at under brain health and our risk and the factors that we look into, you'll start to see why we want to include cognitive, emotional, psychological, and behavioral functioning. It gets more complex. So hopefully this is one that can be of use to people. And if this is helpful, you can have access to this slide deck afterwards to find these. And this is a slide that comes from AARP's Global Council on Brain Health too, just to point out that brain health is about if you're looking at all of this circle put together, about 90% lifestyle and 10% genetics. Because if you were to take that little gray slither of your genetics, that's about 10%. And you have your lifestyle that sits within your options that you have that are within your physical environment, as well as your access to medical care. So a lot of these things we have influence over to an extent. And it's a lot more than what we previously thought before. And the role of genetics is still a lot of times influenced by our lifestyle. We'll talk about some of those risk factors later on today in the presentation and how the interplay between them happens. But to let people know there's a lot more influence that we get to have over the way we live our lives and the options we get to take every day. And so just that reminder that brain health is our health. That's why many of us are here and interested today. And that we can continue to understand, what does that dementia risk reduction start to look like in everyday practice? So there are likely three terms that many of you today have familiarity with, but these are the three main terms that come online when we're talking about dementia risk reduction in this space. So I just want to point them out. It's neurogenesis, is the brain's ability to generate new brain cells. We see this happen across the lifespan for aging adults, even aging adults with neurodegenerative diseases like dementia, through the way they live their lives and through the activities they participate in. So if you're engaging in cognitively stimulating activities, your brain can still grow new brain cells. We see this in adults that practice with dementia, the Curtin Kriya meditation. For so long, they can still grow new brain cells in the hippocampus, the area of your brain strongly associated with memory. So the way you spend your time and your energy in particular leisure activities can still offer benefits to the brain. And so this is those neuroscience terms coming into interplay with the way you spend your time and your energy into investing into brain health. This comes back to neuroplasticity, the ability to adapt and change your brain through the way you're spending your time and your energy. And this comes down to your cognitive reserve as well. And this is that brain bank that you hear people talk about, your brain's protection to development of damage to the brain. So a lot of this comes online with the Alzheimer's and dementia research of showing that people have the pathology in their brain if you were to scan the brains of Alzheimer's and dementia, but they're asymptomatic, upwards of about 7 years. Now, newer research is showing we can buffer that even longer. Last week's research showed that women, we get to buffer that even longer compared to our males counterparts with cognitive reserve. The science is constantly changing. So it's an exciting time to learn about brain health science, but these are kind of the key terms that come online in this conversation. And to show that all of these are lifelong processes that happen from young children all the way to adulthood, even in people that have neurodegenerative disease, not just Alzheimer's, it happens with Parkinson's, happens with multiple sclerosis and other neurodegenerative diseases. And these were the ones that were myths of aging too. We thought the aging brain wasn't able to adapt and change. And we keep learning more and more about how it does. The super agers keep showing us more. The centenarian research keeps showing us more about how the aging brain is changing and adapting. So I'd like to ask now, before we dive into what are the risk and preventative factors to brain health, what do you guys think are the risks to brain health? You may help me update my list as we go. And I want to point out that this is kind of where the brain health conversation starts to shift a little bit, because I've talked about how the brain health conversation has been pulled out of the Alzheimer's and dementia space. However, when we talk about risk to brain health, the way that it's currently analyzed, at least at the global level, is we look at how do we prevent the global burden of Alzheimer's disease and dementia across the world. So we look at risk to how do we mitigate risk of Alzheimer's disease and dementia at the global scale. And that's how we define risk to brain health currently from the Lancet Commission reports tend to lead the field in public health initiatives across the world, still here in the US, guiding a lot of the policy and interventions that we have. If you're looking at the population health level of CDC interventions, Alzheimer's Association interventions, we're leaning on those current reports. So now the conversation kind of comes back to the Alzheimer's disease and prevention space for what are the risks to brain health. And so now we've got the chat going. And we have some that I will say that this list is not exhaustive. So what happens when they convene for these reports is they do look at what's the strongest data, but there's still a lot more on the list. So let's see. You guys have a lot of them. And I will compare as we go because you guys have hit some of the big bucket items and there are some we're going to come back to. So at first, I think to define this is you likely have very working knowledge of what is a brain health risk and what is a protective factor. And it's not necessarily perfect science, but you may think about this a little bit of in terms of a balance beam. A risk factor is anything that has an adverse impact on the brain. Smoking, social isolation, sedentary lifestyle, or poor dietary habits. The protective factor I have in green, kind of mean green means go. These are things that are good investment for your brain health. So anything that protects brain health. So it's the opposite. It's good social connection. It's good quality sleep, physical activity, nutrition, and hydration. So I can pose the question too, what also do you think might be the protective factors for brain health? We came up with a pretty exhaustive list here in the chat of the risk factors. What might be some of the protective factors? We have lots here in the chat. We have quite a few. You guys have landed on quite a few top 14 of the lifestyle protective factors. So I'll pose the question on what might be some additional protective factors. And I'll highlight here, in terms of the global conversation from the Lancet Commission. So they garner experts from across the world. I believe they just recently met in the spring in the Global South for the convening to kind of start the conversations on the next report. So they do touch bases in between to say, where's the current research sitting on risk factors and what are some other ones that might be coming online? And they look at global consensus to say, what is enough to say that we should invest in mitigating risk factors all across the world for global burden of dementia. The last report came out in 2024, and they landed on 14 risk factors that could mitigate 45% of global cases of dementia across the world. And that could be, they could be prevented or delayed by targeting those 14 risk factors. And I like to point out this list has slowly emerged over time. So in 2020, there were 12 risk factors that targeted about 40% of global cases. In 2017, there were 9 risk factors. There are about 35%. So when I talk about that this science is constantly changing, it is being vetted. They look for what is the best information that we have available across the world and what is the information that we can put forward to influence population health. You can see how this has slowly changed over time. And then the percentage of impact that it can have over time. So we've slowly added risk factors. We've been increasing the percentage. So a couple risk factors increased about 5%. We'll talk about what those are. I'll show you on the next screen what that will look like. But in the chat, you guys have really added a lot of ones that are, I think, a balance of what is on these scientific reports. And then also the ones that if you were to go to your healthcare provider would absolutely address with you. And we will talk about that because there are ones that show scientific consensus for population health. And then there are ones that may not be on this list, but if you went to your healthcare provider and you started the brain health conversation, be that your neurologist, your primary care doctor, there are absolutely ones that they're going to ask you about that might not be on this list. So there is a balance, and we are going to talk about that next. And I believe you guys have caught quite a big list of these ones. So let's see where we can go now. And I pulled this particular infographic. If you're familiar with the Lancet report, they show a lifestyle projection of where the risk factors come online from early adolescence to midlife to late life. I like this one because it's a little easier to digest than their one that looks like a snake. So you can pick your preference, but I put this one to be a little more user friendly. It starts with the risk factors earlier in life, and then it goes across here for midlife. Early in life, the best risk factor we know for people is to invest in quality of education. That's one of the best things you have for your brain. I will say one of the largest limitations we have really for any research study to date on understanding education is the way we define education is formalized years of education. So we simply ask that by degree attainment in years you spent in public education. So it gets a lot harder for adults that continue lifelong learning without degree attainment or volunteerism. Now, we know all these things are fantastic for your brain, but it's really a measurement issue for a lot of researchers. And that's one of the things we're still sorting out if you're reading a lot of that literature. So just keep that in mind. But what we say for this research is as much education as you can get early in life and continue that. So this continues all throughout your lifespan is quality of life. Now, if you come to midlife, you might be wondering, why are there so many risk factors in midlife? I've just been reading a book about midlife. It's because you spend the bulk of your years in midlife in adulthood. This is also an artifact of research because midlife is the years that we have the least well defined. So the way we define midlife is 40 to 60 plus or minus 10 years. So that's ages 30 to 70 is how we define midlife in a lot of the research. So now you may understand why most of these are midlife risk factors. The ones with the purple arrows are the two risk factors that came online in 2024. High cholesterol is one that we know is a leading issue in the US to pay attention to. Hearing impairment was one that came on in the previous commission report. If you notice, those are the two largest risk factors in midlife. Those are two that we can easily intervene on in our current healthcare system. We can check on those. And those really mean for any of those midlife risk factors, what they mean is if they go untreated. So if you have the risk factor, you can mitigate it by managing it with your healthcare providers and making it a priority for your health. So those are all the midlife risk factors in there. And then later in life, those are the same ones, but those are the ones that show late life issues. But the one that came online was uncorrected visual impairment was the new one. It took some time. When I trained in cognitive aging, we always knew that hearing loss and uncorrected visual impairment mimicked cognitive decline for a very long time. It just took a long time for enough robust research to come online to say now this is a risk factor that we can intervene on. So sometimes it takes a long time for data to get enough to influence policy. So I'm going to chunk these now because you might be wondering, how do I make sense of these? I'm going to try to cluster them, which is a memory technique to say, how do we make sense of these? If you think about it in an easier way, it's manage your long-term health conditions. Many of the leading health conditions that we have in the US that we have familiarity with: blood pressure, diabetes, obesity, cholesterol, depression. Many of these are screened throughout the healthcare system and can be managed with your healthcare provider. So if you have any of these health conditions, you manage them well and you mitigate your risk. The two big ones I mentioned with studying cognitive aging, you screen for these and you work on making sure these are a priority. I know this is a tough one as someone that works with my mother for her hearing health. It's like wearing glasses. Most of us are much more open to wearing glasses, but when it comes to the hearing issues, it takes time in finding the proper device, but making sure we prioritize the hearing impairment and how much that can dampen our cognitive abilities if we are compensating constantly. It's draining your brain's energy, but doing what you can to prioritize those annual appointments and making sure we prioritize that for our health. The other one, yes, it is. I should say that it's uncorrected hearing impairment. Yes. So making sure that both of them get corrected. And also, we did a podcast with an audiologist, is making sure that you're using your hearing devices. So it's not just enough to get the device and use it 2 hours a day. The research shows it's about a 10 to 12 hour time window minimum. And so it's making sure your brain is actually adapted to the hearing device and using that. You can listen to that podcast as he talks about how the brain adapts to that information and making sure you're using it properly and maintaining the maintenance on both devices. And you guys in the chat, you nailed this one on the lifestyle factors. But the big ones, many of us have awareness of excessive alcohol use, physical inactivity, quality of education, not smoking, and social isolation. This one came online pre-pandemic, although the pandemic really put a spotlight on the importance of social health and well-being, although this has been a part of the World Health Organization's definition of health for a very long time, prioritizing the social aspects of our health and well-being. One of the largest questions I get, so I'm making sure I put this on the next slide, is the units of alcohol. The report is much more lenient than any public health organization, at least here in the US is, for any age group, and even older adult age group recommendations or adult age groups. This one is 21 units a week, which is not any public health guidelines for adults, but everyone always asks me what a unit is if you read the report. So this is how the units transfer to drinking. I just share the information. I was not part of the report making, but if anyone is curious about this, this is why it is way above what alcohol recommendations are for public health. So there's a lot of leniency here in the alcohol consumption. This is also one where you can get a lot of information about what type of alcohol to drink for brain health or not, but really the general rule of thumb that I've heard from neurologists that I've interviewed on the podcast or medical providers that I've talked to is this is not one that usually anyone's going to recommend that you add in to your diet for brain health. So talk to your healthcare providers about this, but this one was a larger recommendation window. Oh yes, for alcohol where men and women are concerned, usually women, sadly, we get the short end of the stick. It's usually one alcohol beverage a day per the guidelines here in the US, and men at most it's two, and usually no more than 5 to 7 per week from the latest guidelines that I had read. And so, yes, that's usually where the gender differences are for most of the guidelines. But this report describes it as 21 units per week on the Lancet Commission. And so there's a little bit of differences between the units of alcohol there. And for environmental toxins is kind of the last two on this report to point out is it's air pollution and head injuries have come online. Most of this also is showing in low and middle income countries, the different types of head injuries, and a lot of them are linked to exposure to violence in other countries. And there's a lot of talks that likely the violence exposure, we're seeing a lot more research coming online that we will likely see that potentially as another risk factor, as well as I've seen a lot of chatter about sleep apnea likely being one that will come online at some point too, as ones that we can readily intervene. I've seen a lot of you put in the chat where you've hit big buckets. If you were to go to your healthcare provider and you were to talk about brain health concerns, you are absolutely right. If you went to a clinician, they are going to ask you about your diet. They will ask you about your sleep and likely your stress management. These are not ones right now that are part of the Lancet Commission report, but they're absolutely ones that would be top part of the conversation you would have with your provider. There's been a lot of mixed if we will ever reach consensus on the diet one, mainly because a lot of that is so individualized, especially with specific brain-based conditions. But if you look at a lot of the diets per se, they have a lot of overarching similarities, which I'll show in another slide coming up. But you've hit on a lot of the other ones that this isn't exactly a perfect list, but from a population health point, these are the ones that they target. But you've hit on a lot of the other factors and conversation points that come up if you were actually talking brain health with your provider. There are other areas that absolutely are part of the conversation. So what happens if you put all this together? Really, lifestyle interventions that target multiple risk factors benefit people regardless, whether or not they have a high or low genetic risk for dementia. This is what the Lancet Commission report shows. And I just wanted to point out 2 additional studies for you. What does this look like in real life? One of these is a slightly older citation, but this one looks at if you look at older adults who adhere to a larger amount of healthier behaviors, they have a 60% lower risk of developing Alzheimer's disease compared to adults that look at 0 to 1 healthier behavior. So what we start to see across all of the studies is a cumulative effect of people that do these smaller brain health lifestyle changes have a cumulative effect over time to mitigate dementia risk. The one most people are likely familiar with here is the US Pointer study. The one with the Alzheimer's Association put out earlier this year is like the brain health recipe. What comes out of the Pointer study looks at a multi-domain intervention, physical exercise, monitoring your health with your blood pressure, your weight, your annual labs, nutrition. They followed the MIND diet. Most of the diets, if it's the MIND diet, if it's the DASH diet, if it's the combination of the two, you have the Ornish diet, which was the vegan type diet of that one. You have the heart healthy diet, which is very similar. They all tend to have a plant forward focused diet leaning towards whole foods, more fruits and vegetables focused, limiting unhealthy fats tends to be the overarching themes of those diets that tend to have a brain healthy benefit. If you're curious, we had Maggie Moon, who talks a little bit about that. She's a dietitian around the MIND diet. And a lot of those studies have found kind of the wiggle room with that is you don't have to be perfect on those diets. About 70 to 80-ish% adherence still boost both benefits for your brain. And so, being close enough in that diet area for people that don't have very particular health needs, but following more of these patterns. So leaning more towards that plant-based diet with healthy beans, the nuts, limiting your sugars, avoiding unhealthy fats more consistently does have an impact on your brain's health and function over time. And, there is a margin of error where you can still, enjoy other foods pending your own dietary limits. Everyone has their own nuance of things, but overall has a good benefit for your brain. And she can talk about that from the dietitian's perspective if anyone is interested there. And she breaks down a couple of the more recent studies. But wanted to kind of put this all together in perspective for everyone if you're looking at that. They used the Brain HQ study in the study here for the training. So this was the computerized brain training. We had Dr. Henry Monka on of Brain HQ on the podcast too. So if you really want to understand the science behind that, you can hear directly from him. As well on the podcast, if these things pique your interest, we try to have additional resources for people. But you can look up kind of how these different elements all start to come together to have a multi-domain intervention for people that has good outcomes for brain health. And really, where does this all start to come together is this neuroscience piece. I like this image from Sharp Brains, is it really just starts to show all across the lifespan for people is if you have this gain, this is what you get here. This is the idea of cognitive reserve. and we get to delay the disease. So depending on the discipline, if you're talking the field you're in, or if you're talking to different people, where we're talking about this delay the disease, right now, the buzz term in the brain health field is we want to call this your brain health span. If you're in longevity area, they might call this your health span. If you're coming from other areas, we just call this, your aging years gained, or some different lingo. Everyone calls these years gained different depending on your discipline. But if you talk with people, they will tell you what that means to them. And this is the idea that we delay the disease, we delay cognitive decline, we delay functional impairment. We get to live the lives we want to live on our own terms and how we would like to live them. I think of one story that I've had permission to give from a woman when she was in one of our caregiver groups. And she said, she was caregiving for her husband who had dementia. And at the time, she goes, I look back to when he retired and I thought he was having a midlife crisis. He worked a full career and he decided he wanted to go get his pilot license. And I thought, whatever, he can go. She supported him. He went and got his pilot license and he started flying, learned how to fly a small plane. And they started doing weekend trips. I'm in Ohio. So he went to little areas around Ohio, and then they went to smaller states, and they did that for about a decade. And through that, they got to go visit family and friends, explore different areas, and even took other friends on these small, short weekend trips. And she goes, I really had no idea where this idea of his came from. I really thought it was him having a midlife crisis, with the caveat that's also a myth of aging. And she goes, but I supported him, and we went and we got to make all these memories. And she goes, I have all these photo books of the trips we took with family, with additional friends. And she goes, I now understand why. Because when he started his journey with dementia, it was a challenge and things had happened. And she looked back and she goes, that's why we got to make those memories. I have all these fond times with him. And if he didn't do that, she goes, I know his journey would have started. We would have been down this path how many years ago? So she understood what that looked like. And she goes, but at that time, I just thought he was having the midlife crisis and wanted to go do these things. And this was her words of kind of what this all meant for him, knowing him and spending her life with him up to this point. And she goes, I'm just grateful that he made the decision that day on a whim to get a pilot's license. And she goes, and now we will walk this journey with him in dementia. And she goes, I don't know what this is going to look like. But she goes, now I get why he decided to do this. And she's like, I'm just glad I supported him. She goes, I didn't know what we were getting ourselves into. She's like, but now we have all these memories, and so does my family. You never know what this looks like. This is not by any means a perfect science for people or individuals. Unfortunately, the bad side of cognitive decline, or the dark side, however you want to word this, is people that have very robust cognitive reserve, when they get to the neurodegenerative diseases, their slope and decline is steeper. So what that means is they have more brain atrophy before they become symptomatic. So a lot of people, that this is the hard part for caregivers and family members, is they're like, the decline is much more rapid. So if you think about this for people that might be doctors or lawyers or professors or very skilled at the trade, they might be a very skilled plumber and they've been very skilled at what they've done for a long time, is all of a sudden, when their symptoms present, the decline is much more rapid. And this is because the robust cognitive reserve that they have built up over those years is their brain has withstood much more pathology at the biological level. So much more plaques and tangles if it's traditional Alzheimer's disease before they become symptomatic. So you have to think about that. The level of injury on the biological side is much more advanced for someone with very high cognitive reserve than somebody who doesn't have cognitive reserve. So it becomes a much more balanced conversation. Now, many people would say, why wouldn't you invest in cognitive reserve? It's not necessarily a bad thing, but it is a very real world conversation that a lot of caregivers or care partners have to realize that at the time, not everyone has that perspective per se to realize, but the slope is a lot steeper. There's a lot of research that shows this for very high cognitive performers. The research study that came out last week for women was showing this, that the reserve slope for women was steeper, but it's because cognitive reserve was so much higher that by the time they became symptomatic, that the slope for their pathology was steeper. But that's not very surprising because cognitive reserve was much higher. So depending on the literature you're reading, I just want to point that out, that it's something to be a little more cognizant of for people that work in this space. It's something to support care partners through as well. And then I know many of you have got here, we've had a lot of this on here, is the amount of other risk factors that come online for the brain is long and plenty. And I can say there are some that are very evidence informed. There are some that's almost the Wild West. So I just wanted to point these out. This is by no means is this list exclusive, but we've covered quite a bit here. You guys have covered quite a bit here in your list. So I want to acknowledge that you guys have had a lot on here. Yes, you guys got quite a bit. I need to add a few more, actually. Jessica, I'll have to get this chat from you. There's always more to add, but I try to make sure to not get the font so tiny. And you won't
Absolutely.
get this.
I'll get you that chat.
When I say they're wow, like I had one colleague share about flatulence. Yes, you've heard that right. Being a brain health risk factor. So there's all types of things out there about things being linked to brain health. But there's a lot of these things where I mentioned earlier that they're not a bad investment of your time. You know, they yield positive things for brain health. And it's always a balance of your time and your energy and where that can go. There's specific vitamins, specific nutritional patterns. I want to point out about wildfires and heat exposures. We know the summer is a time where neurological burden can increase for a lot of brain-based conditions and symptoms go up with the heat, to be aware of that. We know the way we view our aging process. Positive views of aging can buffer even APOE4 status. So the genetic disposition that we have for APOE linked to Alzheimer's disease, if we view our own aging process more positively, that can buffer time of when we have Alzheimer's disease onset. Even more recent research shows the way we engage in the arts can do the same thing with APOE4 status. So it's that interplay of lifestyle and genetics can go both ways depending on the way you're spending your time and your energy. But there is a lot. So not an all-inclusive list. I wanted to make sure I put one more thing on the radar for people today. There's been some chatter around this, is because you're probably thinking there's so many things. Where do I invest my time? And that has been its own risk factor that has come online as an under-recognized social determinant of health. And this is potentially as important as education or income for dementia risk, is because there is an unequal distribution of discretionary time related to brain health. So what we have found in some of the research is you need about 10 hours a day minimum for your brain health. Now you might be thinking, that sounds like a lot, Krystal, but you're spending about 7 hours of that sleeping off of the research, about 45 to 60 minutes of that moving your body in some way, that physical activity component. They're estimating you're spending about 20 to 30 minutes of that doing your meal prep, as well as consuming your meals. So about an hour and a half on nutrition, about 3 meals a day there. The recommendation is now then about an hour throughout the day, then in your social engagement to get you to that 10 hours. So that does not include other leisure activities or hobbies that you do. So they recognize that essentially like the daily lifestyle components that you need occupy about 10-hour minimum just to meet the minimum thresholds around daily brain care for people. So if you think about that, it's your sleep, your movement, your nutrition, and your connection to others around brain health. And we recognize, this is disproportionate around people, typically for women, people that may be in the workplace working multiple jobs as well. So this has a global element to it too, but wanted to just point this out as, a lot of the things around brain health might not have that financial component, but the time component, it does require shifts and it does require investment of time and energy. So I just wanted to put that forward for people to recognize, and just kind of end with the idea of what can you do today to support your brain health? What are the things that might be one actionable step you can do for yourself, for those that you serve? What could you do? I realized some of the graphics didn't load here, so maybe they did on your end. If this seems overwhelming, I'm right there with you. I started to build what I call my second brain over on Substack. Every week I publish a Brain Health 411, so you get 4 of the latest research articles summarized about what does the study say, what can you do, and where can you find it. So free resources, that's my favorite word, is free. So everything you will find from us is easily accessible with no cost. You can find it there if you want to follow along. It's a weekly newsletter, or you can just go there to look to see what's up there. I just wanted to let you know that this is kind of the call to action for the National Brain Health Plan. Is everyone deserves a life with the healthiest brain possible. I think for all of us here in the work that many of us are doing, is that's probably the vision we all see and want to share for ourselves and those that we serve in the work that we're doing. If any of you have this type of licensure, I have a podcast. It's called Let's Talk Brain Health. We featured Stronger Memory on there too, so you can always find that episode. But we do offer free CMEs through an affiliate podcast with Pinnacle Podcast Network, so you can find free CEUs there. They're self-reflective questions, so hopefully nothing will trip you up. You can learn the brain health science, tell them how you apply it to the work that you do, and get a free half-hour CEU. And if any of the things that I may have mentioned today, you can find us on our website, but we do some virtual brain health book clubs once a month around some topics of brain health. And you can always attend our silent book club, which, yes, is a meeting where nobody talks. It's just silent, and you can read whatever you need to read, or you can craft whatever might be some quiet time for you. And next month, we have an author appearance by Dr. Conley McDowell. So if you've been hearing the research about how gait is the 6th vital sign for your health, you can join us for that conversation, or it will be on the podcast. So make ourselves as accessible as we can. You can easily find us online. Anything on our website is free and accessible to you. So hope that can be a resource. And I know we've covered a lot, so I may have missed some questions along the way there, Jessica.
Thanks, Krystal. That's okay. I've been collecting some of the questions,
Okay.
and you answered a lot of them that were related to specific slides. But thank you so much for sharing all of that. I'm super excited for this next book club. That book has been on my list, recommended by a few Stronger Memory participants, actually. So I'm super excited about that. One
Well, the
general
research about your feet is fascinating in there. I learned a lot.
Yes, yes, absolutely. And for everyone in the chat, if you have additional questions, feel free to put them in the chat, or if you click the raise hand button, then we can unmute you. And if you need to hop off at 1 o'clock, you can. Krystal, I don't know if you have a few extra minutes, if there's a couple questions. Okay, great. So first question, Diane Watson put in a question. Is there a place where people can go in order to get some older person peer support, certification, or information where you share knowledge with others who can't or don't have access to medical care?
To poke around for that and see if I can get back to you. But if you send me an email, if I get her email, I'll follow up.
Okay, Diane, we could definitely connect you. And then someone else said, Catherine said, I don't know if I missed this, but is there any research that demonstrates a relationship between genetics and dementia?
There is some. I think the largest one that you see is about the APOE4 allele,
Mhm.
and some being the greatest risk factor with that. But I can poke around. I think I can get you a resource on that that you can follow up to read more specifically. I can get you a link for that.
That sounds great. And then someone, I think this was asked when you were talking about the additional factors. Someone asked, what about pain as a factor for brain health?
I haven't read one specifically as that as a risk factor for brain health, but I would
Okay.
say that's likely a one that you would talk to a healthcare provider about to get
Right.
more information on because it's likely a symptom of something. It's definitely
Yeah.
telling you of there's something going on to have and start a conversation with to not overlook.
Right. No, absolutely. And then, oh yes, and she clarified chronic pain, not just regular pain. So,
Oh, yeah.
um,
I think there's a lot with that with regards to a lot of what you hear about with nervous system and talking about, with your brain and what you do for, nervous system care and
yeah,
mind body type practices, whatever the language might be for what people are comfortable with talking about, because there's a lot of it's all of that is a sign that there's something going on. So it's to dig a little deeper and to get some information around that.
great. Thank you. And then I'm seeing a few people say, thank you so much for your presentation. Would love to connect and learn more. So we'll make sure that we send out this recording to everyone, and also that we send Krystal will send you the attendee list and the chat history. Are there any other questions?
Well, I'd like to say I thank everyone for the engagement and the time and investing in brain health. It's a hot topic. And Jessica, thank you so much for hosting such a wonderful event. I know it's a lot to cover in a compressed amount of time, but I appreciate the
Yeah.
brain challenge as well as everyone investing their time and energy today too.
Thank you. You did such a great job, Krystal, and it was so informative. We really appreciate you. So thanks. We'll have to do more again, and definitely check out Krystal's podcast and her Brain 411. Super informative, especially I see lots of our stronger memory facilitators in here, and I think that 411 resource is a great one when we get questions from our participants. So have a wonderful rest of your week, everyone. Thanks so much.
Thank you.